let's talk about the bomb that just dropped in Washington. And I'm not being dramatic here. So, again, let's start with the elephant in the room because this situation is getting harder and harder to ignore every day. And I don't know why people keep ignoring it, but somebody got to speak about it, right? Right. So, it could all be so simple if we just had one set of rules to follow. But instead, we've got federal laws, state laws, contract requirements, and international consideration all mixing together in this pot like a complicated tea blend. And not a good one, may I add. Here's what's really happening. States are essentially building digital walls around patient data. Texas just passed a law, and I'm talking brand new, fresh off the legislative press law that requires all all electronic health records for Texas patients to be physically stored in the United States. Not just backed up here, not just accessible from here, physically located on American soil. Florida beat them to the punch earlier. And now we're seeing Wisconsin, Arizona, and others following suit. It's like watching dominoes fall, but in reverse. Instead of everything tumbling down, we're seeing walls being built around everything and built up. Now, here where it gets a little more interesting for all of us in the coding world. These laws don't just apply to storage, they apply to access. So if you're a coding company that uses offshore resources and those resources can access patient data, you could be violating state law, even if you're following federal HIPAA guidelines. So now let's talk about the bomb that just dropped in Washington. And I'm not being dramatic here. I really am not. When you think you've heard it all and you hear some more, you be like, wow, I didn't even know we can go any further than this. This is going to reshape our entire industry. It's called the Know Upcode Act. And yes, that's a real name for a real bill. It was introduced by Senators Bill Cassidy and Jeff Merkley.